Text Nation, Melinda, take one. Right.
Melinda, if you can just state to us your name, your profession, and how long you've been in this type of profession.
My name is Melinda Jones, and I am a pediatric critical.
Sorry,
We're going to start that over.
Yeah, we'll do that. You guys go ahead and get settled.
Okay.
Okay. And action.
My name is Melinda Jones, and I am a pediatric critical care nurse and also a neonatal NICU nurse. I've been a nurse for since 2014, so 8 years. And I am also a grad student for mental health nurse practitioner.
Thank you, Melinda. He'll ask you questions, but actually keep your eyes on me.
Okay.
And if I look down, it's okay.
Okay.
Good thing.
Melinda, give me a regular day for you. What do you deal with in the NICU, for instance?
Well, typically in the NICU, it depends on the type of patients you have. You could have up to 3 to 4 babies that we would call just feeder growers, or you would have more intensive care patients that are 1-to-1 or just 2 babies that are on ventilators, or if they're just 1-to-1, those babies are pretty sick. And so that is just depending on the shift that you are working and depending on the patients that you get for that day.
You ever witnessed any strange dynamic with family or babies, or where you felt that something is off, and that could literally just be a gut check? Or where I'm going with this question ultimately is women who are giving labor that may be under duress.
I can speak for one particular shift I took care of, a mother who at the time was not present. She was actually getting evaluated for postpartum psychosis. And I was taking care of 3 babies that shift in separate rooms. It was very tense, slightly hostile situations prior to my shift coming on. And this mother was coming back, and my concern was I can't be in the room if she decides to pick that baby up and throw baby out of the crib. So there was a lot of tense situations. However, throughout that shift, I just made it a point to make conversation with her, to get to know her. And at first she was very put off by it. You know, she kind of stated, I don't mean to be rude, but why are you talking to me? Well, I'm just trying to get to know you. And prior to me working with her and taking care of her baby, she did not allow any of the other nurses to change their diaper, to feed the baby. She did everything. But I think with a little bit of understanding and not judging her, because that did become a conversation between the two of us of how she felt as if she was being judged because of her mental illness. I ended up, she allowed me to feed the baby and allow her to get some rest, and felt very relaxed and safe enough to allow me to come back and take care of her child the next day.
You know that to work with you, we fight sex trafficking.
Mm-hmm.
I say sex trafficking in your line of work. Have you ever experienced anything, seen anything?
Yes. So as a pediatric critical care nurse, I float everywhere in the hospital. So every unit, ICU, ER, the floors, medical surgical floors, everywhere except the psych unit. And I was working in the ER that day. We had a 14-year-old that was brought in by police from Weatherford, Texas, and she was found to be with truck drivers. I believe she was smoking meth and also having sex with the truck drivers there. So she was brought into our ER. We have a behavioral health unit that's just a particular section of the ER where all those children go, as young as 5 all the way up to typically 17. And this young lady was very hostile, very called us every name under the sun. She was not happy, she was angry, she was fighting us. At one point, I remember standing there with a security guard where she was in the corner out of bed, threatening to rip her IV out, using foul language. And it was our job to kind of get her to settle down and get her back safely in the bed so that we could get her upstairs and admitted to the floor. I found out about this girl's story, and I can't necessarily blame her for acting the way she did, but she was a product of the state of Oklahoma, from what I heard. Was very neglected as a toddler. I'm sure wasn't able to find out the details of that, and then she ran away and then was being obviously trafficked here in Texas. And so, for her to act to be very difficult patient, I understand why she was. Unfortunately, there weren't many other staff nurses that could sometimes empathize why she would be the way she was.
Trafficking training, or how to identify trafficking in the hospital system and in nursing school, is it present? Is it non-present?
There is no education from my perspective as far as sex trafficking for nursing. The only time that I ever had any sort of education as a nurse was Cook Children's did set up a scenario of having a young girl or a teenage girl come in, maybe with another teenage girl, and then a gentleman who is not related to the patient. And if we suspect any sort of, and it's also based on our intuition, if we think something is quite off, they gave a scenario and training of how to ask the visitors that were with her to step outside of the room so that we could do, our questions and exam for patient privacy, and then to ask a series of questions that if they were to indicate that she was in trouble, then we would take the next steps to get her the help she needed.
Were those next steps clearly laid out as like a protocol?
They were not. I per se did not have any experience actually having that scenario as a nurse, and I honestly am not sure if other nurses would be comfortable really initiating or asking those types of questions or suspecting that something is quite off and doing something about it.
The general question about care for children in different hospitals, without naming we don't have to name a particular hospital group, but the general care in 2022, have you seen care over the last 5 years go up, or have you seen general care for the patient go down?
I would say it's gone down. In my opinion, in my experience in the last 2 years, healthcare is definitely not what it used to be. The hospital, in a sense, is in the business of making money, and it's also with a shortage of nurses. We are put in situations that are not necessarily patient safe, and unfortunately, there are a lot of nurses that will not speak up and say, hey, I can't take this assignment. And those that do, I've heard that, whether it's the boss's boss, they will say, well, we'll just find somebody else that will. It's happening across the country from groups that I've talked to and listening to other nurses' stories, but that is seeming to be the trend of more unsafe patient assignments, and not enough, I would say, nurses to the point of wanting to speak up or do anything about it, just kind of doing what they're told.
I want to talk a little bit about nurses who do want to speak up, whether there's a support structure in management in general, whether that's celebrated, and how is that handled if someone does speak up?
I don't particularly see in the adult/children facilities that have both all those age groups of patients that they see really show initiative for those that do want to do something about it. It takes a lot of time and effort, and then they're looking at a money sense. And I'm not quite sure if some of the staff nurses and even physicians are, in a sense, comfortable with diving into seeing this as a big problem and doing something about it. But for those nurses that do, that want to do something, if we were, the next step would be to work with our educator department, management, supervisors, and then essentially it's, the CEOs of the hospital.
Is there anything on your mind right now that you would like to talk about, Melinda? I've got a couple other questions, but that you want to share. Let me give you just a moment to share freely.
I would say, for me, a lot of what I've seen between sex trafficking and mental health, especially amongst our pediatric patients, it's a huge problem. It's part of the reason why I chose to change my degree plan to be psychiatric mental health nurse practitioner was, back in 2018, I started looking around at our behavioral health patients in our ER, and it didn't matter what day of the week it was, if it was a holiday, if it was Mother's Day, if it was Christmas. We have children coming in left and right, 24/7, as young as 5 and as old as 17, either attempting to commit suicide or having some very major mental health issues. And we definitely do not have the means to support that, let alone sometimes I think it gets put to the wayside. And I really thought about when I changed degrees is I really want to work with those children, especially adolescents group, because I feel like when they're that age, majority of what I see come through the door is about, I would say 80% is their life at home. What's going on with parents? What's going on in their home structure? And essentially they're crying out for help in a way when they show up at our door. And a lot of those children will say, and some of those parents may be really great parents, but they're paying attention to us as adults, their parents, and they see maybe our own mental health issues, maybe our own stress, anxiety, and they don't want to burden mom or dad with another issue. So they hide it. There are ones that have rough lives that they've unfortunately grown up in that don't have that support. And they're still walking through our doors, and it's a cry for help. And hopefully, once I graduate, I tend to work somewhere to work with those adolescents, because I feel like if there's just one or two kids that I can get through, show some support, hey, we had a bad day. We made some bad decisions. Tomorrow's a new day. I've made poor choices as a teenager, and I'm lucky that I had the sense and support, and even though challenges, to know that I made a mistake, but let's move on and we can do better. And really encouraging them and supporting them so that they can hopefully have better days than less. Yes, please, thank you.
Melinda, I have a question for you. You can think about this. You may not be able to speak to this, but you're speaking about how these kids come in with these mental issues because of how things are at the home. We deal a lot with how porn contributes to trafficking. Kids, when they find themselves in porn, it's an addiction. Do you think that there's enough shame just from that addiction and wanting to hide it that they don't feel comfortable speaking to their parents? I need help.
I believe so. Because
rephrase that in your answer. Rephrase my question.
Oh, I'm sorry.
You're okay, yeah.
I do see the addictions to, I would say, social media sites for number one, that lead to probably porn sites for young adults, teenagers, children. And yes, I believe there is shame with coming forward and discussing that with their parents. That leads to further mental health issues. Just an example, I have a teenage daughter. She tells me all kinds of things that she sees in the bathroom, walking down the hall. Kids are videotaping other children having sex at school, whether it's girls and girls, boys and boys, or vice versa. And we had a friend of the family that, found a video of 2 boys in the high school and shared it with others in the intent of exposing that was wrong. And instead, he ended up, suffering the consequences of, I guess, the way he went about it. But I didn't hear any discussion of, well, what's going on with these 2 boys? Where are their parents? I mean, that's 30 minutes from my house. And to them, to teenagers, at this point in time, sex with friends and all genders or whatever is normal to them because everybody's doing it. And I don't think they realize the consequences of what that causes, both emotionally, physically, but yet mentally later down the road.
To that point, and what you're learning now in this transition from pediatric care to really emotional and psychiatric care, how difficult is it to actually help a person heal from trauma? It takes, I know the answer, but it takes a lot of effort. I mean, it's serious work.
It does. I can say, as a personal experience, with the loss of my brother almost 3 years ago, I myself had a point in time where I waited 8 months past his passing to get the help that I needed. Mental health, as far as, having a support system and talking to somebody and working in a group for about 6 to 8 weeks. And I can see why that is a problem because it boils down to money. A lot of our children that come into the ER for mental health are stuck there, whether it's to find a place for them that will take them, or whether we can support them at our facility. And again, it boils down to money, insurance, because if they don't have the money to do it, well, guess what? They're probably either not going to go, or they're going to go to a place that may not be the best choice for them. And unfortunately, I've even seen some of these teenagers that have gone to these facilities before come back in our ER, and they know they're going to go there because that's where their friends are. It's just a vicious cycle, and I don't think there's enough attention to the problem at hand because it's a hard topic to deal with mental health, because a lot of the mental health has a lot of background as to whether, is it sex related, sexually assaulted, porn, were they molested as a child? And nobody wants to talk about it. And that's the problem I see, and it's just this never-ending cycle of, if we're not going to talk about it, then how are we going to do anything about it? And then we're just going to add on to, unfortunately, more and more children having more and more mental health issues and getting involved in very treacherous acts and situations that could potentially end their life.
Mm-hmm. You may not be able to speak generally for people, but do you think it's also common to see a teenager or even a young child, because the average age of entry into porn is age 8 through 11.
Mm-hmm.
So when let's say that child watches porn for the first time, do you think it's pretty easy among the general population for that child to come to mom or dad and say, hey, I don't feel good about what I'm seeing? Or do you think shame traps them?
I think young children watching porn, depending on how they were exposed to it, especially with what we see going on around us, is, making it a good thing to be around, sexual explicit people and behavior. They may not see it initially as something bad, and when they do, I feel as if that would be a difficult situation to bring up to parents. We have, I believe, an 8-year-old in my past experience with a fellow nurse that became a psychiatric nurse practitioner. She was dealing with I believe she was 8. Her parents owned a sex shop, and she was in our facility for mental health issues. And she asked her the question, like, well, have you ever, watched, someone having sex on TV? And she's like, oh, no. And she kind of reworded her questions to the point where she finally was like, well, yeah, I have, And it's like as a mother, as a parent, as a nurse, how I don't understand some of the parents and the choices that they're making and think that's okay for their child. And for the child to even have the sense to come talk to their parents and say, I don't feel comfortable with this. How do we even get to that point?
Lastly, I want to talk medication a little bit. This is a general question. Children on medication. It's a broad. Where are we as a society? Do we have a lot of children on medication? Not? Are we in an upward or downward trend? What's your experience as a nurse?
My experience is we have a lot. I remember taking care of a 5-year-old, and I was giving him his anti-anxiety / antidepressive medication at 5 with mom in the room, and watching him kind of run the show and not really having some sort of structure or routine. And I can't even imagine. We don't go from A to Z when it comes to medicating children for mental health. We shouldn't do that for really sometimes anyone, but you can give medicine all day long, but if you don't address the problem and work on that problem and address the situation, you're not going to go anywhere. But yes, that's a lot of the initially family members that are in their early 20s. Oh, well, I'm having a hard time talking about a few things, and they go see someone. Well, here's some medication to also add on to that. And I'm not saying it's a bad thing that's not used. It's a time and place in certain situations, but it's not an end-all be-all. And I feel like a lot of our younger generation, well, I could just take a pill for that and fix it, and it doesn't.
Can you give me a definitive statement such as, I'm seeing a lot of young people on medication, something to that effect?
I do see a lot of young people on medication for mental health. I see 5-year-olds, I've seen teenagers, I've seen early 20s. If they're in there for behavioral health issues, depending on how those issues came about, usually there is a medication involved that we are going to give them that's prescribed that they go home with.
Thank you.
I think I've got my critical questions answered. Anything else? Tammy, Dan, Becca? Anything else from a nursing perspective? My critical ones were, were also, it's her moving from NICU into mental health. That whole mental health crisis in the youth is insane.
Mm-hmm.
And when you take that and you layer on it sexual abuse and then pornography and medication, they've got no shot.
Mm-hmm.
It's like it's a avalanche. I think I'm good.
I do have one question.
Okay.
Melinda, would you speak to, through your experience and what you're seeing in the world today in the culture with gender fluidity and gender confusion and dysphoria, what are y'all seeing in the hospital, and how are y'all being taught how to deal with it? Because is there any training for what is going on in this culture? Because we know children are being very confused.
Mm-hmm.
In school, in education, online, everywhere.
Mm-hmm. There is definitely a shift in the gender dysphoria and pronouns and trying to decide what gender you are. And the hospitals, even children's that I work at, pediatric hospitals, are facilitating some of that, because I did attend a behavioral health conference where one of the speakers was discussing how we should go about treating our patients that, are biologically male and feel like they're female. And at that point, I had to step aside and realize, this is not what I signed up for. I feel like it is I don't want to say political move, but it's in a sense of going along with a trend and not addressing it as, okay, let's talk about this. Let's take our time and think about, there are such things as gender dysphoria, but there's also things as in they're being teenagers, and are they just following a trend? because even my own children and their friends are saying similar things. That it's everywhere on TikTok and everybody just talks about it openly and freely. And there's not enough discussion of let's slow down, give it some time. There is just now all of a sudden we're getting training as nurses to make sure we address our 8-year-old patient with the right pronouns, and God forbid we offend the parents while we do it, or I don't know. But they are in suit with what we are seeing across the board in that situation.
I want to ask a follow-up question on that. Do you think that contributes to mental health?
100%. I think gender, I think hospitals and physicians and or nurses or teachers going along with the gender dysphoria, the trend of, transgender surgery ideas and plans for that is going along with. Sorry, so can you say that one more time again? The question.
Does it contribute to the mental health crisis we see
Okay.
in the youth?
Yes.
Hold on 1 second. So this whole gender identity crisis that's infused by media and the marketplace, when doctors and nurses go along with it, does it actually contribute to the mental health crisis?
Yeah.
And we'll finish with that one.
Yeah, hold on for me 1 second.
Did you get a hold of Simon? Oh, okay. Try Doug as well.
Ready?
So the gender dysphoria, the confusion that we're seeing amongst the younger generations, I believe is contributing to increased mental health. These kids obviously are coming in with anxiety. There's questions of some of these girls that I've had friends of my daughter that come out to their friends and they're saying, hey, I'm bi. And then the friends that are hearing this, they don't even know what to do with that information. So there is a trend of the gender confusion going along with increase in mental illness in our youth, in our adolescents.